it was weird. It was like, it felt like deja vu, but it was a physical feeling. So deja vu is normally just, mental. But the first time it ever happened, I heard like a voice. And the voice, I could never figure out what the voice was saying. It was more of like, who is this voice? It was not like I thought someone was actually there. It was like I was trying to remember something. A month later, it happened again. And that's when I really got scared. That's when I called my doctor, because she had mentioned on the phone that they found something in my brain. And then the fact that she told me that I had to go see a neurosurgeon, I knew it had to be serious. I mean, it was nothing in between. She sent me directly to a neurosurgeon. Just a tumor in my brain,
It was just out of the blue. He's only 36. It was really a surprise, a big surprise. He automatically went to the worst. He started doing like online research, and he just started, it was just all negative stuff.
I just had a feeling like, oh my God, I was thinking like, wow, my girls, they're older. I figured like if something happened to me, they could understand it. Like my little boy, he's 5 years old. And, that's my son. Like I just had have so many plans with, like stuff me and my father do, like hunting, fishing, camping and stuff like that. And I just thought like, I'm not gonna be around.
He loves his kids, like so much. That's what was tearing him apart in the beginning, because he was like, he was like thinking that he wouldn't be here for my son, and that my son wouldn't remember who he would be.
When patients become part of our clinic family, their life has been altered. And so the way they thought their life story would play out has been completely changed. And patients are immediately worried that their life's plans and hopes and joys are not going to come to fruition. And oftentimes we have to tell patients, most times we have to tell patients that this is going to significantly shorten their life. Even if it doesn't, it's going to forever alter their life. And so everyone's needs and emotions are different. And so when we do that emergency responding, we're there trying to help everyone where they are at the moment where they are. All right, good morning, everyone. Welcome to Tumor Board. Today we're going to start our Tumor Board off with a few cases. The first is a 36-year-old father and husband who's having deja vu experiences for about a year, and he presented into an outside hospital for concern of a seizure or stroke.
We see this large right temporal lobe lesion. It extends up into the insular region, but it's largely limited to the right temporal lobe. There's a small focus of contrast enhancement anteriorly in the mass. The small focus of contrast enhancement would make it seem that this is undergoing anaplastic progression from a low-grade to a high-grade tumor.
So for a 36-year-old, with every aspect of his treatment is going to be better if he can have that removed. I've recommended a attempt at complete resection of that tumor as his best treatment option. That'll lower his chance of future complications. It'll make any other subsequent treatments he might need more effective.
And it'll generate more tissue to be able to get an optimal diagnosis. We need to know what this is and have enough tissue for routine analysis of our subsequent treatments, as well as a potential clinical trial. All right, next case.
I mean, now as the day get closer and closer, I'm starting to think about the fact that I'm about to have surgery on my brain, so I'm getting a little nervous, but physically, I feel fine.
Mr. Almalik. Hi there. Welcome back. Come on in, please. Have you come into the summer?
Have you had any change in your symptoms? Increase in the seizure activity?
Well, I had three since the last time I came.
Since the last time you've been here?
Yeah.
Okay. But similar in the deja vu feeling, voice type stuff?
Not sure. The voice, not too much of the voice. It's just I get a physical feeling too, and
You have a funny smell or taste or a feeling in the pit of your stomach?
I don't know that.
It's a hard thing to describe. A lot of people say it's really hard to describe.
Hi.
Hello.
What are you doing?
Good.
Well, teaching aid. Good to see you guys again.
So good to see both of you again.
Good. So what that MRI told us was that it was just in the temporal lobe. You got two halves of your brain, right? A right half and a left half. And generally the right side of the brain controls the left side of your body and vice versa. And so where this spot or this tumor is in your right temporal lobe. Okay? Kind of right there on the side of your head. Right? Straight in from above your ear. So that's in a favorable location. It's a computer-guided surgery, so I never know for sure exactly what my incision's going to look like until I get you asleep and finish the computer programming. But the guidance system will tell us exactly where we want to make the incision. But looking at you have nice hair, so we don't want to lose any. But the way it's going to work is there'll be an incision that'll either be like a C shape right here, or like a question mark like this. Tumors look very similar to normal brain. So that's what the computer guidance system really excels at, is telling us where does the tumor stop and the normal parts begin, right? So that you can only remove the tumor parts.
So when you take it out, will it be like empty, like a cavity right there, or something eventually filling it?
Yeah, because it's involving a part of the brain, and you have to actually remove that segment of the brain that it's involving. That part of the brain, there'll always be a space there where it used to be.
Is it like growing inside the tissue of the brain? Or is it like on top of it?
Excellent question.
Really good question.
It's an excellent question. So we think of it very much as a population of abnormal cells that is similar to like a storm. So if we look at a Doppler weather map and we're looking to try to characterize and understand the storm, you're going to see red is the most intense population of abnormal weather or abnormal cells. And then it'll be orange, yellow, green. Yeah. You can never really say I put my fingertips on that last water droplet, but you see that it is like a mist or a fog, or it is like a storm that dissipates. So that's where the goal of the surgery is, to take out as much as can be taken out safely based on the location of it.
So MRIs take slices, right? So this one is a slice like you slice a tomato and you're looking down from the top. And we come up a little higher, there's your eyeballs. Right there.
Your cool
And
ears.
so, yep. So this is the normal side and the abnormal side. So that's the tumor there. But the important thing is that's in a very favorable location where we should be able to treat it very aggressively and safely at the same time.
All right.
It's always disconcerting to look at your own scan with a tumor on it.
It's like a bully picked a fight with you. It wasn't your doing or choosing, right? You didn't do anything to bring this on. But until we size it up, then we don't know how to give you the best possible care. So part of it will be not only removing as much as we can safely, but getting all that tissue out and understand the best way to slow it down or kill it to the best of our ability. And then we're going to put the tools in your hand that you need to go forward. So this is the first way we're sizing it up, and the first way we're trying to beat up this bully. But it's always humbling and scary when you look at it right in the face.
Yeah.
I don't know, I guess I never thought about it until now, but how your brain actually just controls everything, every single thing. They did a good job explaining it. But what's gonna stick with me is what happens after. Well, once we get through it, if everything is gonna be normal.
Now, if you can go in there and change some things, make me be able to sing really good, or smarter or something, that'd be pretty awesome too. But I just want everything to be normal. I want to think the same, act the same. I just want to be me. It's really nervous now. So there's nothing I can do with it but pray.
See when I look at you.
Everyone's deepest fear about brain surgery is somehow I'll lose my identity. And so fortunately that those kind of functions in the brain are not all in one place, right? They're very distributed around, and so it's very rare to alter somebody's personality with a surgery or turn them into a different person, for example. So, but that's what every patient worries about. I told him I'd say his dread, so that's going to take a little time. So, but he has nice hair. People like to keep their hair. It's psychology, right? So if I do a surgery, the next day your head's all shaved and there's a big bandage on there with some blood on it, people go, oh honey, I'm so sorry. I'm so sorry. And then you think you're sick. Whereas if you walk in the next day and your hair looks nice and they can't see the incision, they go, man, you look great. And if you tell people they look great, they do better, right? And so it's psychology. Keeping their hair actually helps them recover. So that's why we do it. So I've been doing this a long time. Where the experience comes in is knowing how aggressive to be. When we do brain tumor surgery, we have this invader. It's not supposed to be in there. It's a bully, like Dr. Dunbar says, that picked a fight with the patient, and you want to go remove every bit of it. You want to do the best job you can for the patient, but there's always a line where you pushed it too far. And if you push it too far, that's when you can hurt people. The 20, 30 years of experience is knowing where that line is. For the typical cases that I do, it's harder than normal. The tumor location and the tumor size, the proximity to arteries that could predispose him to a stroke during the surgery or some type of brain injury where he might have weakness on his left side. The ability to get right to that line that I talked about and not cross it. That's what the difficult part of the surgery is.
I'm here to ensure nerve integrity and to make sure the patient wakes up being able to move. I have electrodes in his face, arms, and legs. The tumor's on the right side, so that controls the left side of your body, so all down the left side. I'm stimulating his hands and his legs, and I'm getting a response up in his scalp. And that's to ensure the sensory region is intact.
He's doing fine. Everything went good. He's waking up. And so we were able to get to the tumor and find it and expose it, no problem, and get a good removal of it. We'll find out later what it's called, why it's there, how long it's been there, does it need any other treatment, how closely do we have to follow it, do we have to worry that it might grow back, that kind of thing. So we'll sort that out later. But he came through it just fine.
And what was the size of it?
So the food analogy is a lemon.
For real?
Yeah,
Wow.
something like
Are
that.
you kidding?
So, but it really doesn't matter how big something is. It matters what it is.
Right.
There's awful things the size of a BB, and there's fixable things the size of a grapefruit. So. He hasn't woken up enough to talk yet. I know he doesn't drink or smoke or anything, but he looks like somebody that drank a pitcher of margaritas. So he'll wake up within an hour or so. He'll be talking. Okay.
Yeah.
Right. Anyway, he did wonderful.
That's worthy of a kiss.
Oh, yeah.
They might well get mine.
Amen. That's pretty deep, man. Yeah.
Malik, يومي إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
So part of my job, beyond just giving them a diagnosis by looking at the scope and reading the images and deciding what the tumor is making sure that there is appropriate material available to send out for additional testing so that all of these molecular tests can be done. Because all the molecular tests will essentially drive how the patient is treated. So that gives the oncologist as much information as possible to make sure that their treatment is the most appropriate thing that they'll respond the most effectively to. So this darker pink area right here is normal brain. And then over here we have the lesional tissue. So when you take a closer look at it, you can see that the cellularity is a little higher, that there's just more cells in here. And with brain, you like to see these really nice, round, pink nuclei, and you start to see that they're starting to lose a little bit of that shape. But there's way too many of them. The cellularity is just too high. Typically, essentially in all areas, the lower grade, the better. Brain in particular, that there's a pretty drastic prognostic difference in a low-grade tumor versus a high-grade tumor in the brain.
He's okay. It's just hard to see him like that. He's there, just not physically yet. It's hard for me because I know it's hard for him. He wants a cane. He doesn't want the walker because he said he's not that old.
So normal is kind of a relative term because each patient kind of presents differently and they heal differently. But in his case, he's not fully aware of his deficits. He's a little bit on the impulsive side, so we have to use a lot of repetitive cues, and he's not fully aware of where his body is in space right now, but he's also medicated and a little bit more lethargic, so not fully aware of the safety issues.
So we tell our patients every day they have to be well enough to get treatment and well enough to want treatment. So likewise, I have to be well enough to care for patients. So I have made a commitment to try to do something physically active every day. That's not only for my health and my resilience, but it also keeps me mentally in the game and gives me enough reserve to be able to give back every day. And I have to squeeze it in early in the morning before my cell phone starts going off and all the needs of the day go by. I think the analogy of the bully is a natural analogy when people are suddenly faced with something that was not their doing or choosing. Sometimes these patients are in the middle of their day and cancer comes their way, and it's like a bully around the corner. So our job as advocates is to put the right tools in their hand, flank them with people that are gonna help them. And in that analogy, I'm one of their battle generals. And so I have to be physically fit, and it's gonna be a war, so I need to be mind, body, and spirit ready for the challenge. Information about brain tumors comes in waves. And any tumor cell that has the capacity to grow and divide on its own or spread within the organ or beyond is a malignancy. So the overwhelming majority of brain tumors are malignancy. But that's actually just the beginning. It's not just the cell type or the early information about how fast it wants to grow and divide. So it's now at the level of molecular genetics. We want to know, do they have a certain mutation or a certain marker that makes us smarter about how to help them? Maybe something that not only helps us predict how well a treatment will work, how long it will work, but also how to give them the most freedom from symptoms or side effects. At the heart of it all, we're educators. And so we have to help someone understand unbelievably complex things as fast as we can so that they and their families can make the best individualized decisions. It's unbelievably complex to understand that a tumor is now part of their life and to understand what it might mean for their future.
Need some music, like a theme song.
You need music for what?
A theme song for when I'm walking, like the superheroes. Physically, I feel fine.
You may feel fine, but you're a little bit less balanced than you used to be. So that's why we're working with you. It's just a matter of your brain telling your body what to do now. Take it slow. Try to hit your heels first. You're dragging your feet.
See, when I walk, I just got a natural stride when I walk.
Okay, slow it down.
That can't be controlled. Lightning. Now you want to see me run at 40?
No. No, sir.
We have a lot to go over.
Hope it's good. Hope you guys have some good news.
We do have some good information. So we know that it's an astrocyte type. We know that it's a grade 2 out of a possible grade 4. But really the most important information is below the level of the cell type and the grade. It's actually what we call the molecular genetics, which is the metabolism and the different aberrations or abnormalities that made a normal astrocyte go on a journey to become clonal and become a tumor cell. So that pathway is unique to each person's tumor, and that pathway of abnormalities is how we learn to outsmart it the best we can. So we know that the most important thing was that a maximal safe surgery was done, and that by far gave you the best opportunity to live as well as you can, as long as you can. But in general, the next steps would be most patients with astrocytoma tumors at some point benefit from a zone of radiation. And there's a small possibility that you might benefit from a medicine to be added in at that time. We don't have the tools in 2018 to cure this tumor by one treatment surgery, right? This is more likely than not to come back in your lifetime. But what if it's many years or many decades from now? So at the end of the day, our goal is how can we help you have the right tools in your hand that we are able to make that be as low chance as possible, as far away as possible. If this tumor comes back, and realistically we should plan that it could and will at some point, that we have even more technology and treatments to be able to do an even better job at that time. Does that make sense?
Yes.
We want every chapter to have as many pages in it, and we want to have as many chapters as possible. But no matter what, we'll be with you as you go forward together, helping you make the best possible decisions.
Thank you. I really appreciate you guys. Knowing that I have a tumor in my head and that could possibly come back, and I may not have much longer to live, all these things, but thinking that it could come back and I may not live another 10 years. I just try to think of the positives. Try to think positive.
He's fully functioning. He's alert. He's on very little pain medicine, so he's back to himself. Everything's the same. He remembers everything, and he can do everything he did before. Even the incision is amazing. How I did his hair yesterday, and it was just like, it's crazy. Like, you wouldn't even know that it was there. His brothers came over and fried fish yesterday, and they were hanging out there listening to music and throwing the ball, and it was really, really, really cool. It made me happy because he was really worried about not being able to play catch with his son. So yeah.
Good throw.
We're hopeful. trying to stay focused on the positive and you know, live the best quality of life we can.